Hey everyone, thank you for being here today. My name is Tom Friedman. I'm the Executive Administrator of the State Health Plan. It is an honor to serve in my role. It is an even greater honor to get to introduce you to the new future of the State Health Plan. I know it's easy to talk about premiums. It's easy to talk about these things separately, but we've compiled a group of partners from preferred providers to our TPA and our pharmacy benefit manager committed to reducing the total cost of care for North Carolinians. So I'm going to be the MC today. So first I'm going to turn it over to Treasurer Briner for a couple comments. I'm going to turn it over to Roy Watson from Blue Cross, Carl Armada from Novant, and Dr. Christy Page from UNC. So first, Treasurer Briner.
Thank you. Thank you, everybody, for being here. Today marks an important milestone for the State Health Plan, and more importantly, for the nearly 750,000 members who depend on it every day. To our members, I want you to know this. Every decision we made today was guided by one simple principle. How do we deliver better health care to you at a price you and the state can afford? For too long, healthcare costs have grown faster than the resources we have to pay for them. We could have accepted the status quo and kept asking our members to pay more. But how will we protect this plan for years to come? Today's actions strengthen the State Health Plan through better partnerships, smarter purchasing, and a new approach that rewards high-quality, lower-cost care. By approving preferred provider agreements with UNC Health and Novant Health, we're creating incentives that benefit both our members and taxpayers and are great for the providers too. This is novel in healthcare, but it's actually normal in business. Competition drives value. It encourages innovation, and ultimately it delivers better results for our members. These systems will officially take the preferred provider designation on January 1st, 2027, and we can't wait to work with them. We're also welcoming back Blue Cross North Carolina as a trusted partner. It will be serving the State Health Plan as both the third-party administrator and also the leading partner for our pharmacy benefit management solution, beginning in 2028. I want to repeat that, beginning in 2028. Blue Cross brings deep experience, proven capabilities, and a shared commitment to delivering better value and a better experience for the people who depend on the plan. We estimate that over the term of their contract and through our own efforts with our new preferred provider strategy, we will be trending towards over $1 billion in savings. I know change can bring questions, especially when it involves your health care. That's why we're committed to providing clear information, helpful tools, and one-on-one support before these changes take effect. We want every member to understand their options and feel confident in the choices they make. I firmly believe this path is the right one. It preserves access to high-quality care, improves affordability for many of our members, and puts the State Health Plan in a stronger, more sustainable place for the future. To every teacher, every state employee, every retiree, and every family we serve, thank you. You've dedicated your careers to serving the state of North Carolina. Today, we're making sure the State Health Plan serves you just as faithfully in return. Thank you. Over to you.
Thank you very much. Good afternoon. Blue Cross and Blue Shield of North Carolina is extremely excited and grateful to be selected to serve the teachers, the state employees, the retirees, and families of the State Health Plan beginning in January 1, 2028. I want to thank Treasurer Briner, Tom Friedman, the Board of Trustees for the State Health Plan for giving us this opportunity and trusting us with this value benefit. We understand the responsibility that comes with this decision. As North Carolina's only not-for-profit health insurer serving all 100 counties, we are committed to working together with the state, provider partners, hospitals, members, and healthcare to make sure that healthcare is more affordable for all. In the months ahead, our focus will be on ensuring a seamless experience for members and partnering with the plan and their leadership to deliver practical solutions that reduce costs and support a better health for the State Health Plan and all North Carolinians. Thank you very much. We really appreciate it.
Great, thank you. First of all, I just want to thank everyone, and I particularly want to highlight our North Carolina State Treasurer, Brad Reiner, for the work that he's done to focus on affordability, and Tom for the great work that you've done with the health plan to find ways to be innovative with affordability. I'm honored to be with you here today. My name is Carl Armato. I'm the CEO of Novant Health. And at Novant Health, we know that affordability is one of the greatest concerns facing patients and families today. We believe healthcare decisions should be driven by what's best for the patient's health and not the fact that costs are driving those decisions. And we believe that the uncertainty of costs is also getting in the way of patients being able to access the health care they need and deserve. And that's why we're proud to be one of the Tier 1 providers for the North Carolina State Health Plan members. With a network of more than 900 locations, including 21 hospitals across the Carolinas, the designation gives some state employees, retires, and their families access to Novant Health all across North Carolina, where they'll have access to 18 hospitals, 700 physician clinics, and as well as ambulatory surgery centers and imaging centers that we've also moved to freestanding. So they've got access to new price points. But with this relationship and this partnership with the state health plan, we're actually creating a more affordable benefit that's going to be available through the plan. From Asheville to Wilmington and most places in between, Novant Health sets the standard for the highest quality of care. And we're proud of that, delivering the most remarkable outcomes that people need and deserve. Today, that care just became more affordable for every state health plan member. This Tier 1 designation builds on our existing partnership with the state health plan through the Lantern surgical benefit, which has helped members access high-quality surgical care with no out-of-pocket costs. I'm going to say that again, no out-of-pocket costs. And since the early, just 4 months into 2026, we've had 500 members request and receive surgical care that has not required out-of-pocket costs. So that cost uncertainty was eliminated. So I'm really excited about the future potential. We are already seeing benefits of our joint efforts to make it easier for members to receive the care they need from providers they trust by reducing their overall costs. We also recognize that even when care is affordable, medical expenses can still be difficult for families to manage. So that's why Novant Health also offers a flexible payment options, including a 5-year zero-interest payment plan, so patients can focus again on their health rather than worrying about the care and how they're going to pay for the care, not delaying care because of costs. Helping patients prioritize their well-being has been a long-standing focus of Novant Health. We continue to explore innovative approaches to improving value, increasing transparency, and reducing costs for patients in the communities we serve. In many of our regions, our primary care providers, pediatricians, women's care services, and orthopedic clinics offer same-day or next-day appointments so patients can get the care they need without waiting. Patients can also access us through their 24/7 virtual care. And in 2025, just to give you an example, Novant Health facilitated nearly 500,000 virtual care visits. The same surgeries and the strategies that we've used to help all of our 44,000 Novant Health team members stay healthy and manage their healthcare costs, we're now using that to employ that with other communities across our regions and partner with the state health plan. For example, we just recently partnered with the state health plan and obviously the Lantern program, but we've also been working with Charlotte Mecklenburg Schools to support the well-being of their district employees Over the last few years, just the last year, in fact, we've provided more than 2,000 Charlotte Mecklenburg school employees services like health screenings, on-site education, and concierge care navigation. Today's announcement is an extension of our long-term focus that reflects a shared commitment in doing healthcare differently and better for the people who serve North Carolina. Our goal is simple: to make healthcare easier and more affordable. By improving access, lowering costs, and maintaining the higher standards of quality, we're helping create a healthcare experience that works for patients and their families. Whether patients contact us in person or through virtual visits or digital tools, they can expect the same high-quality coordinated care across the entire Novant Health system. Today, I'm proud to say that North Carolina deserves high-quality health care and and we're pleased that Novant Health will be delivering remarkable care to every state health plan member. Thank you. Christy.
Good afternoon. I'm Christy Page. I am the CEO of UNC Health and also the Dean of the UNC School of Medicine. I'm a North Carolinian, and boy, is this a great day to announce these exciting things for North Carolinians. I am so proud that UNC Health will become a preferred partner for the state health plan. As North Carolina's public academic health system, we are owned by the people of North Carolina. And we're here to serve the people of North Carolina. And with that comes a unique opportunity to make a lasting impact on the broader good. And that's what we're announcing today. We share that commitment with members of the state health plan, with our teachers, our law enforcement officers, public servants, our colleagues in the UNC system, and with our colleagues within UNC Health, myself included. Creating closer connections between our statewide health system and our state's public servants, this is special. And we are talking about our neighbors, our colleagues, the people who are here to invest in our state. And to be a part of this just makes so much sense and is exciting for our future. UNC Health serves patients from all 100 counties, and we are working hard to expand access to high-quality care all across the state. We have a deep commitment to our rural communities, and we're working on new and creative ways to make sure all North Carolinians receive high-quality care no matter where they live. We've been actively working on expanding access, workforce, and technology to prepare to serve more patients, including members of the state health plan. We will support the state health plan members with scheduling and other needs to make care as seamless as possible. What we're announcing today is a long-term partnership that will help us achieve that goal by providing more options for care and helping make it more affordable for state health plan members. At UNC Health, we're proud of our role as the state's health system. And as our state grows, more North Carolinians rely on us for their healthcare needs. Today's announcement helps us extend our Carolina care in new ways to the 750,000 members of the state health plan. We're truly honored to care for our state's public servants who are working together to make North Carolina a better place. I'm just so excited about the future of our partnership and the opportunities that this presents as we work together to combine our resources and come up with new and creative ways to solve complicated problems on behalf of the North Carolinians that we serve. Truly, this is a special day for so many of us, especially the members of the state health plan who will benefit from this. Thank you so much for allowing us to take this time to share with you today. And now I will turn it back over to you, Tom.
tremendous thank you to all of our partners and wonderful job. This is really exciting. This is really different. So we have a lot of work to do to communicate all the great things ahead. And I think we have the right partners. I think we have the right staff. We have the right stakeholder partners to be successful here. I assume there are some questions. So now I will open it up to those.
What were some of the pain points you had previously heard from state employees about how the health plan had been run? How do you feel this new plan addresses those?
It's a good question. So our members are really good at letting us know about the challenges within the state health plan. Affordability is what we hear about the most. Some people talk about premiums, some people talk about copays, some people talk about cost share, but affordability has been the challenge, as it has been for all Americans. I think that's fair to say. So we knew we had to address that road bump. And from the commitment from our partners here, from the commitment from Blue Cross, we have a path forward to address affordability in a way that the benefit was structured 15 years ago. So I think that is the step one we've heard is healthcare is too expensive. And as we look at our members with more and more chronic conditions year over year, because we've made it unaffordable for them to manage their health, we have not invested in our members. This is the roadmap to investing in members' health. So we've heard it is too expensive, you are not investing in us, and we just feel like a cog in a machine. I don't know how we can be clearer going forward that you are not. The partnerships we have here, they're showing the value that state employees and teachers have across the state of North Carolina. I joke, but not joke, the money we save, I don't get to keep. I don't get to go on vacation with that money. That is money we invest in population health. That's the money that's going to be more available for salary increases for state employees, which is another thing we hear quite a bit about. So I think this helps us address the big concerns we've heard from our members and help us go forward in a direction that addresses all their issues as best we can.
Just to make a finer point on the premiums versus total cost of care. Premiums are a shorthand for cost, and I understand why people fixate on premiums. But if you look at the examples we provided, it is just the tip of the iceberg of total cost of care for people. So we're really focused on lowering total cost of care, total out-of-pockets, where we're talking about lowering costs by thousands of dollars. Premiums are going up by $2. That is factually accurate. But the thousands of dollars of savings, that's what matters to our members.
For people who are stressed out or frustrated, going to have to find new doctors, new hospitals to assimilate to this, what resources are available for them to be able to make that transition easier?
It's a great question. So we have many resources in place. Our partners talked about the different scheduling options they have and the different ways that they're going to step up and address those concerns for members. We are updating our provider lookup tools. When we talked about our consumer segmentation study today, our members go to our website for ways to save money. We are going to embed those into places today. Part of our solution through Blue Cross in 2028 is enhanced patient navigation. So we are going to tackle this a lot of different ways. We are also going to be as in front of this as we possibly can. We heard today that some members prefer email, some members prefer in person, some members prefer videos. We have to do all of those things really, really well over and over and over again and show people what their options are, show people what the value is, show them the opportunity. And we're not saying you have to switch. We're trying to say, as healthcare costs go up and there's a difference in price, some of that is going to have to be borne by the member. And when there's savings opportunities, you get to take advantage of those savings opportunities first. And we're trying to be transparent in how the value of healthcare services are priced.
So will doctors have more openings and stuff, or how does that work?
We are actively working on both adding physicians, improving our access tools, and expanding our virtual care, knowing both that this is coming and that access is such an important aspect for members all across North Carolina, especially in those rural areas where virtual care can be helpful. And I think you spoke to that as well. I mean, this is a big priority for us.
Yeah, I will tell you. So at Novant Health, one of our main strategies has been access for all North Carolinians. And so we've been opening up more primary care sites. We've hired a whole bunch of advanced practice providers. And if you look at our virtual care capability too, we can get people answers 24/7, regardless of the time of day or night or early morning that they need access to care. So the beauty of that is we're trying to find new access points so that people, particularly in this transition, we're going to be open the doors wide, including the same day or with the next day access. to many of our primary care offices.
Dr. Briner, can I ask about the third-party administrator?
Sure.
Blue Cross was dropped just a few years ago. Now they're back. Former Treasurer Falwell talked about an issue with price transparency. I'm wondering if you are satisfied with that question now, how things have changed, or if that was never an issue.
So I was not in the room when the last decision was made around transition from Blue Cross to Aetna. What I can tell you is that we ran a fulsome RFP process here. We got the results of that, and the decision was very, very clear, both from a cost perspective, from a member service perspective as well, and then from every other dynamic we can think of. There was really not much of a contest, to be honest.
Can you tell me how many companies responded to the RFP?
The TPA RFP, there were
Right.
3 respondents.
2 made it past him.
2 made it past minimum requirements.
In the, referring to what Lynn was talking about, one of the things that Treasurer Falwell complained about was lack of transparency. Will there be more of that? Will you have more insight into the prices that Blue Cross is negotiating with providers?
Sure. So I'm going to ask Tom to add on to my answer to this question, but you can't extract the preferred provider program from that question. What is an evolution that may be not so obvious, we are doing a lot more direct contracting with providers than we ever have before. And so the TPA used to do all of that for us. Now we're in partnership with the TPA to do that. So our ability to understand exactly what is going on increases dramatically as a result of that. And so those two things are linked in that way, in that we have a front row seat now rather than a back row seat to all these conversations.
No, I think that's a good point. And I think transparency in healthcare is really important. And making healthcare more affordable is the most important thing to me. Asking someone to go online and type in hundreds of thousands of CPT codes for something they might need at a point in time is useful, and I think that's valuable. What I think is most valuable is I know what the rates we're paying them are. I negotiated them. I have a pretty good sense of it. What's most important is the member sees the value and they pay less. The member is paying less because we are paying less, and it's the only affordable and sustainable way to do it. So transparency shows up in a lot of ways. It shows up in, if you want to search and look up rates, you're welcome to do that. But also, more importantly, it shows up and helps you make good decisions about your healthcare purchasing. And we can't make it simpler than to say, you can pay thousands of dollars for surgery over here, or you can pay $600 over here, because the prices are that different. And that is the shopping we want members to do. That is the decision making we want to support their members doing. Because we think that is simpler, more sustainable, and probably more honest in terms of the value and the cost that the services reflect.
In some ways, then, who the third-party administrator is essentially matters less than it used to. I mean, in some senses.
It matters different. You know, I think I am one person. Our team is small but mighty, and scale matters. Blue Cross has a tremendous amount of scale in the state of North Carolina. Blue Cross has tremendous resources on the ground, boots on the ground across the state of North Carolina. These contract negotiations took months and months and months. Blue Cross has hundreds of resources that can expedite that timeline, execute on the mission and the values that we have. So it matters different. They are going to continue to be good partners. They're going to continue to have to execute, and we feel very confident we have mechanisms to hold everyone accountable to do that job. But it'll matter different. It'll matter how we get members to the providers we want them to get to. It'll matter different in processing claims accurately, giving people tools and resources to improve their health. They benefit from our scale, we benefit from their scale, we benefit from each other's scale. And I think that is more of a collaboration, so I think it's just different.
The other point to make is the third-party administrator processes well over 10,000 claims for us every single day. So the enormity of it, I think, is underappreciated, what they do for us and what needs to get right every single time.
There was a mention of $1 billion in savings from this TPA contract. Is that just in the value of the contract, or where is that coming from?
So I want to clarify, it's almost $1 billion of difference in cost between the two proposals. The $1 billion of savings is going to come from a multitude of things. The discounts provided by Blue Cross, partnerships we have with these folks, our ability to execute and grow those things. So that is a real number over the term of the contract, but we have a lot of execution to do. We have a lot of steerage to do. Members have to go to utilize these providers to generate that savings. We have to have a framework to execute on those things, but it's about the prices, right? So if we have better prices and we have better steerage and better utilization, members using those providers, that's where $1 billion comes from. We spend as much as we do a year, that's something that should be achievable over a 3-year period.
What is the term of the contract and what is it worth?
TPA? The TPA contract is original 3-year term with 2 optional years on top of things. The total value of the contract, including the network and utilization spend, I think is right around $12 billion.
And how much, and that's out of, like, how much does the state health plan process each year? And just to help put it into context for people, 12 billion over 3 years.
Yes, so that's
And
about
then-
4 a year.
And then how much does the state health plan do over the course of a year?
I mean, we're a little less than $4 billion, so we're trying to figure and accommodate that by trend, and part of that is the same as we get here. If the prices go down, we're going to spend less. We're rebasing those numbers basically.
So almost all of our claims go to the
Yeah, all of
TPA.
it,
I
yeah.
think it's to
I think
answer your
what Lynn
question.
was asking is how much is the Cross getting for administering the plan?
Yeah, that number.
Do you have the number right?
We don't have an exact number right now.
We haven't, so there's a series of optional services within the contract that we're going to evaluate, and so we'll be able to give you a fulsome number when we decide which of all those things we decide to elect to use and when and turn on, right? So there's different population health management programs, there's different member steerage programs, there's a bunch of different suites of services that we think are value add to our members. Some of them help us get our members to our preferred partners. Some of them are the core cost of doing business, and we have to make sure we are investing in buying services that have an ROI. So services that maybe we spend 10 but we get 15 in value out of, that's a different thing than just a kind of core service cost. So we have to spend the next 2 months looking at those optional services and figuring out what is the right value for members. We are in the ROI business, not getting the lowest admin fee business, we're getting the most value business.
When does the preferred provider deal with Novant and UNC go into effect? And are there ongoing conversations with other providers who may be able to join?
Yeah. So those preferred provider contracts go in place 1/1/27. As the treasurer mentioned in June, we continue to be open for business in other areas. These are our health system partners for our preferred tier. That train has left the station. But there are other independent specialty practices, so we can make sure we have access that are interested in. We still have to determine, as I mentioned in the board meeting today, who is going to be the access provider in the Triangle area. We should let you know that in the next couple weeks. So we are open to work with people as long as it creates value and lets us be good partners to the partners that have come to the table and invest in us as well.
The potential Atrium Wakeman merger, has that created any headaches in their ability to participate in this? Has that been taken into account?
We take into account the partners that came to the table and offered us the best deal and the best value. When we started talking about these things early last year, we met with leadership from every health system, and then we had a procurement process for our Lantern services. And it was a different way to think about things. If we're saying you need to compete for our business, it's not really how healthcare works at all. Right? Again, part of the Treasury point, it's novel for healthcare, normal for business. Without hesitation, Novant and UNC came running and saying, we want to work with you, we want to do these things with you. Other folks were skeptical, and they had different models for things, and they were like, this isn't for us. Or they just didn't feel like making the commitment and level of investment that these folks did. So I don't think a merger had anything to do with it. I think it's everyone has different goals and everyone has different priorities. These folks' priorities are clear.
I'm sorry, can I ask a question? Yeah. Sorry, you just said, in terms of the Triangle providers, you said that WakeMed and, what was the other one?
Duke.
WakeMed and Duke, you said they're gonna be Access?
One of the two
One
will
of the
be
two
access.
Access?
One of the two will be access.
While I was listening to your meeting, I thought you were mentioning that one of them will be a preferred provider.
No, one of them will be access.
Can you describe how you're gonna differentiate between the two? Why not? If that means there wouldn't be really a preferred provider in this triangle area.
It is UNC. UNC is
is okay?
UNC is that we are determining the access provider. So in counties in areas where there are 3 health systems, preferred UNC, always preferred health system, always UNC, always.
So it's only be like one preferred in one area?
Correct.
Okay.
But remember, access represents the same cost next year as this year. So access is not bad,
Okay.
but preferred is very good.
Preferred is very good. And then
And-
could the two still be accessed, or is it just one of them going to be accessed?
Our goal, so we have to be good partners to our preferred partners. They are making a tremendous investment in the state health plan and the members of the state health plan. The word prefer means something. We prefer you go there. We are making it very, very affordable to go there. So while everyone wants to win and no one likes to lose, unfortunately there are going to be winners and losers. And that is based on price, that is based on member disruption, that is based on quality. Everyone can't be preferred or they're just giving money away. And I don't think that's how you guys run your businesses as far as I know. So we are intentional about who is preferred from a system point of view. We need to have an access provider because we need to make sure people can access care at the benefit level they do today. And someone's got to lose. If someone's going to win, someone's going to lose. That's just sort of what it's going to be.
And that is how we're going to reward our members for going to preferred providers.
So would you recommend members to start, trying to change providers now or wait?
I would recommend it now. We're giving folks a long runway. My goal is if we can successfully get things done, we will make specialty copays for our preferred providers cheaper in Q4 of this year so that there's more runway to get more healthcare from a more affordable rate. Because we want people to go to these providers. So yes, if folks want to start switching over to these providers now, I think that is perfectly fine. If they don't want to and they're not ready to till the end of the year, that's also fine, that's their decision. But I'm going to keep going back to the word preferred. I don't know how to make it plainer. We prefer you go to these health systems.
Financially, it seems like a great deal as it relates to somebody going to the preferred provider. How do we make sure, though, that the preferred provider does what they need to do as it relates to the employee? And what I mean by that is if I've got a procedure that needs to be done or a medical professional I need to see, and they can't see me for 2 months or 4 months or 6 months, but the access person could see me in a week, how do we make sure that the preferred provider does a better job?
We are very blessed in North Carolina to have very high quality health systems across the board. Just because you are a preferred versus not doesn't mean you're bad at healthcare. Access is a challenge in healthcare today. Will this work seamlessly? No. We are to continue to get better and evolve, and they are committed to getting people in as fast as they can. Might someplace be able to get them in faster? Maybe, but faster doesn't always mean better. Better means better. And so we are to continue to work to get better access for better quality care at a better price.
But will we monitor that?
We'll be monitoring access, of course, and engaging them and holding them accountable. And there's a market force that holds them accountable that's a little bit different. They're making a tremendous financial investment in getting here. If they don't get people in faster and they don't get more people in, they're the ones that are going to suffer and be on the hook for it. They have every incentive from an ethical point of view and a financial point of view. And that's where the treasurer is talking about. Our incentives are aligned. We are partnering here to get the people in better, faster, and at higher quality care. Until we align incentives, we're not going to be able to be as successful as we can. And we've done that. They've made the investment and they've made the choice to invest in state employees and teachers and align our incentives.
But as you saw in the presentation, the team has gone through a detailed analysis of all of our regions, of all of our members, and looked at where capacity exists and where we're capable of sending people to preferred providers. So that has been a huge work stream for over 6 months to make sure we can answer that question well. It's not going to be perfect, to Tom's point, but it's pretty good.
Tom, you talked about this yesterday, and I think, Secretary, you just kind of got to my question now. How much of which state health entities made the preferred providers list came down to the competitive offer or willingness to work with you? How much came down to access?
The term we use is maps and math. We looked at the map and who has the most access points for members. So we were focused on competing in the Triangle, Charlotte, and the Triad. We got the 2 strongest partners there. They also have health, hospitals, practices, ASCs across the state of North Carolina. So in addition to where we wanted to compete, where we wanted to drive competition, they brought more to the table. They brought ands across the board, which is really, really important. Because they are big and serve a lot of state employees because they do a really good job, They also helped minimize disruption. The disruption was never going to be zero, but when we think about large health systems with a lot of access points, that gives us the most places to save and gives people the most places to go for care. And that is something that is really unique, that if you're in Avery County or you're in Brunswick County, you can get the same deal that a member in Wake County can, that a member in Forsyth County can, that a member in Mecklenburg County can. Those gains that we gain by partnering with these folks is how we consider these transactions. Scale, we talk about scale mattering and our scale mattering, their scale matters too, right? The more they can do, the more they grow, the more successful we are going to be. And again, that just kind of goes back, we gotta all be aligned in our incentives and our goals.
Are you able to share some insight into why Blue Cross and C won both those contracts, and do you have any concerns about there being pushback from those who lost?
I mean, there's always pushback. People don't win.
Or, being sued again?
That is always a risk. I think that's happened 100% of the time if I'm kind of going back and looking at things. So I'm aware that that is an opportunity and that is a risk. We make the best decisions on behalf of our members not to avoid getting sued for a lawsuit that we've won every single time. We are continued to be committed to focusing on the member and the member experience and improving member health and member outcome. If I was worried about being sued, I'd have to talk a lot less.
I would also add, when we detail everything publicly, there was really no contest in these RFPs. The decision was so very clear that I would hope that makes people think twice about bringing action around it.
Will the RFPs become public?
Beth, when will the RFPs and what parts? This is I'm going to have to go to our institutional knowledge folks on this one about how this part exactly works.
There are a couple of legalities that we have to do before we can post them, but they will get posted to the website.
Time frame?
I don't have a time frame because I don't know when some of those steps are going to happen, but we will let you know.
It's Friday afternoon, everybody. Thank you for your attention. It's a big day for the state health plan. We appreciate you bringing it to the attention of all of our members. Thank you.
Thank you.